Hi there, I'm Dr. Brett Bingham from Intermountain Pet Hospital. One thing that we're doing now, which is super fun, is we're doing the question of the week. We get questions from our clients every day, really good questions, and we want to share that information with everyone. The question for this week is anesthesia safe for my pet? This is a legitimate question. We all know pets and even maybe a person that has died under anesthesia, so we all have concerns with anesthesia, so it's a great question, and it's a question that I get probably on a daily basis. That's why we're talking about it today. Of course, we all want our pets to have good, happy, and healthy lives, and sometimes that means surgery or dentistry, which means anesthesia. So it means anesthesia safety has to be super important to us, which it really is. In order to ensure anesthesia or anesthetic safety, we have 5 steps that we follow. These are the 5 steps. Okay, step number 1. Step number 1 is a physical exam, which is super important. This allows some time for the veterinarian to listen to the heart, check hydration, gum color, body condition, and many other things. All of those things can be extremely important when we're determining if anesthesia is safe. The next most important thing is a history. The veterinarian will talk to the pet owner about what's been going on at home, because there's a lot of clues that we can get by the pet's lifestyle, which will tell us if anesthesia has any risk with it. And then the last thing is just a consult. The veterinarian is going to want to talk to you about the pros and the cons of the procedure and ensure that the benefits outweigh the risk. That's all included in that initial physical exam. Step number 2 has actually 4 parts to it. The first part is pre-anesthetic testing. For dogs older than 7, we require pre-anesthetic blood work to make sure the organs are working okay. If they're younger than that, then it's really up to the owner and the veterinarian to decide if it's best. The other thing that we do with pre-anesthetic testing is a possible ECG. There are some breeds that have a genetic predisposition to heart disease. In those cases, we'll want to do an ECG before we go under anesthesia. The next thing that we do is we do the consent forms, so that allows the technician and the client to sit down and go over all the paperwork and get all that signed, so that's out of the way. And the next thing that we do is an estimate. We always want you to know what the cost will be for the anesthetic procedure, whether it's dentistry or surgical procedure, so that there's no surprises, and that's all done up front. Okay. The last thing that we do is pre-anesthetic medications. This is really important. We want our patients to come in nice and relaxed when they have an anesthetic procedure, and this is for many purposes. Number 1 is we want our patients to be relaxed and happy. That's super important. Number 2 is anesthetic safety. So when we have a patient that comes in very anxious or nervous, we have to take them from this high state of anxiety to an anesthetic plane. That's a lot of anesthesia. Whereas if they come in relaxed, then we use less anesthesia to get them to an anesthetic plane. So it's just safer. Not only is the pet happier, but we feel a lot happier too because we have a safe anesthetic procedure. Step number 3 is the actual anesthesia itself. Now, before going under anesthesia, the veterinarian is going to want to do another physical exam just to make sure everything's okay. And at that point, he will talk to you or the owner about the anesthetic protocol, and he will set or she will set the anesthetic protocol for that particular patient on that day. Okay, the next most important thing is we have a dedicated anesthetic veterinary nurse, and her job is to monitor anesthesia constantly for the whole time that patient is under anesthesia and even after anesthesia. We always put in an IV catheter, which is really important because we need to make sure that the organs are getting plenty of fluids, which means plenty of oxygen. It also allows us access in case we do need to administer medications to intervene during the procedure. Another thing that we do, which is pretty fun, it's called a bear hugger or a hot dog, but basically it's a contraption that we put around the pet like a nice warm blanket that keeps them warm under anesthesia. If they get cold under anesthesia, then body organs can start to shut down and you can have some organ failure. So we want to keep them nice and warm during the full anesthetic procedure. That's super important. And then of course the nurse is monitoring many things, including the heart rate, the blood pressure, oxygen levels, carbon dioxide levels, body temperature, and the ECG. So plenty of things that we monitor, which are super important. If there's any abnormality or concerns with any of those things that are monitored, the veterinarian is immediately notified so that we can intervene and correct any issues. Step number 4 is anesthetic recovery. One thing that you might be surprised to hear is that most anesthetic deaths happen after anesthesia, not during anesthesia. And that's why it's so important to have a dedicated nurse that's monitoring not only during but after anesthesia. And these anesthetic technicians monitor heart rate, respiratory rate, body temperature, and even pain. They'll monitor and treat pain if there is some pain evident after they recover from anesthesia. All of those are recorded, and then once the patient is awake enough, we offer a small meal, and once their temperature is good and they're eating, we feel pretty confident that we're out of the woods and they can continue to go home. Now that your pet is fully awake and ready to go home, the doctor will schedule a discharge appointment with you. That is when a technician will meet with you and go over everything that needs to be discussed before going home. And this includes medications, what medications need to be given and when. It also includes exercise, like what can you do and what can you not do with your pet. It might also include bandage changes, and sometimes they need an e-collar or some type of a collar to protect the surgery site. And the last thing that they'll talk about is diet. What should you feed, when, and how much? So all of those questions will be discussed at the discharge appointment. We always schedule the discharge appointment because we want to make sure that there's plenty of time to go over all of those really important questions before your pet goes home. Okay, so for all of those people that have that question, is anesthesia safe? I hope this helps answer that question, maybe gives you a little bit more peace of mind. It's a really, really great question. It's one that I get every day, so I think it's important to get that information out there. And I will say this as a follow-up, that there was a study done in 2017 that shows that the risk of anesthetic death is 1 in 300,000 for a dental procedure. So it's very, very low. This was a study that was published in 2017. So we feel confident, especially when we do everything that we can to keep anesthesia safe, that we certainly can. Have a great day.